Dr.Ko. I'm the MP for Kampa, and beside me is Oscar Ling, MP for Cebu. This morning, I would like to bring your attention to an issue, an article that was actually reported in the Star yesterday about the government hospitals running out of funds to treat patients in the government hospital. It was reported in the Star yesterday that hospitals face a shortage of funds due to increased volume of patients seeking additional and they will seek additional allocations. However, the process will take time, especially now that the government is revising its budget. It was reported in the same article that Sultana Noura Ismail Hospital had run out of its allocation and could not perform any more blood tests. The tests had to be sent to Hospital Sultan Aminah in Johor Bahru to be done. Similar incidents actually was going viral online a few days ago in today's .memes.com for the medical personnel and the paramedics. It was titled "Lack of Funds Leads to Suspension of Clinical Laboratory Tests in Malaysian Hospitals." A circular was apparently issued by the pathology department of Tengku Ampuan Rama Hospital in Klang, notifying the hospital staff of a temporary suspension in the pathology laboratory investigation, as the department was unable to purchase any more necessary chemicals to run the blood test. Other hospitals were also reported to be issuing similar suspensions of services. It had created quite a big discussion among the doctors and the paramedics and the laboratory staff online. And the Director General of Health, Dr. Nur Hisham Abdullah, had actually acknowledged on 9 as well the problems faced by the Ministry of Health. However, he revealed that the Health Ministry has seen an increase of 8% in the number of patients from January to May this year compared to the same period in the past year. And this 8% translated to over 3 million additional patients for the government hospitals. Limited funds also affected supply of medications in government hospitals, especially the long-term medications for high blood pressure and diabetes, for example, insulin. These medications must be taken daily, or the patients will develop complications which can be fatal. The hospitals are coping the best they can by borrowing and lending medications from one hospital to the others. If you have surplus of medicine here and I have shortage of medicine here, let's do a swap or something like that. And also they have cut down on the prescriptions from the usual 2 months, 3 months, down to 2 weeks supply only. This is trying to cut down on the wastage and other things, but the hospital staff and especially the pharmacists are worried they may not have enough supply of medicine to last till the end of the year because we have 2 more months to go. The problem with limited funds was always there in the Ministry of Health hospitals. It is much more acute this year because of the budget cut of up to 300 million as reported in the New Straits Times this year by Prime Minister Dr. Sri Najib Razak. The 10% cut in budget definitely put a huge and tremendous strain, but the number of patients increased by the number of millions and millions. Before GST was implemented, Oscar and I had argued that the price rise would result in more patients seeking treatment in the government hospitals. Unfortunately, together with the drop in world oil prices, the economy has suffered a dramatic slowdown. especially in the private sector. For those of us who actually work in the private sector, we have seen all our friends and relatives reporting that they have not had any good months since last year. Many hard-pressed rakyat are no longer able to afford treatment in the private clinics and hospitals like they used to do. The private hospitals, like the KBJ group of hospitals, had reported drop in revenue and drop in profit this year. Unfortunately, GST collected instead of used to help the rakyat as the government promised, is to save the government from bankruptcy and to fill in the black hole, as admitted by the Prime Minister himself. At the same time, the government is pushing ahead with one mega project after another mega project. And yesterday, after the fiasco of 1MDB, not sorted yet, apparently the cost of the high-speed rail from Kuala Lumpur to Singapore is now up to 63 billion ringgit. From the initial 40 billion ringgit to now 63 billion. The biggest beneficiaries, if you read on the internet, the Chinese, the Japanese, and the Koreans are all fighting for this slice of pie. When we cannot even afford to buy medicine for our patients. And these people are already like, wolf, trying to grab the 63 billion. What is the benefit of the high-speed rail when the patients have to take a slow bus to go to the government hospital to buy essential medicine? For this budget, the long-suffering rakyat very much prefer the government to give priorities to the poor patients who are seeking treatments in the public hospitals. Finance Minister Dr. Sri Najib Razak should increase the allocation for the Ministry of Health to buy more medicine and to buy more necessary chemicals to do the basic blood test to cushion the impact of the slowing economy. Thank you. Any questions? Okay, thank you.